from the floor of the Senate now. As part of measures to improve on tuberculosis surveillance in Nigeria, the World Health Organization recently engaged 12,000 community informants to find what is known as the missing cases. This is to help find those infected, test and put them on treatment in order to keep the disease from spreading further. TVC News Correspondent Kemi Balogun reports that the Stop TB Partnership Nigeria is organizing a national TB forum and conference to further create more awareness.
In a 2018 report by the World Health Organization, 4.3 million people were missed globally, and Nigeria accounts for 8% of this number. The Stop TB Partnership Nigeria is one of those partners engaged in working towards ending TB by raising awareness across the country on testing and treatment of tuberculosis.
If you know that there's something like TB and you are aware of what the symptoms are, then you'll be able to go for treatment. Okay? So, first of all, there must be awareness. Secondly, there must be places where treatment can take place.
Out there in the community, people don't know about tuberculosis. This is just an irony, because go there and ask anybody about HIV, they will actually tell you how one can get HIV, how one can transmit HIV. But for TB, the awareness is actually very low, even among healthcare workers.
Tuberculosis is a potentially serious infectious disease that mainly affects the lungs. The bacteria that causes tuberculosis is spread from one person to another through tiny droplets released into the air via coughing and sneezing. Every undetected tuberculosis case has a potential of affecting 10 to 15 persons. And in 2018, more than 400,000 cases were detected, but only over 100,000 were actually confirmed, which means most of the missing cases need to be found and treated. If not, they just remain as reservoirs from passing infection. These partners in the fight to end TB by the year 2030 are calling on other partners to increase funding for this disease as more missing cases are detected.
The National TB program is looking at several strategies, including house-to-house contact, house-to-house testing, screening, contact tracking, active contact tracking, as well as the proliferation of gene expert technology to screen for TB.
The government is funding TB with only just about 7% of the total funding required. The external funding comes up to about 17%. So the total funding we have now is just about 24% of what is needed. So 76% gap. So where do we get that from?
Despite significant progress over the last decade, tuberculosis remains the world's deadliest infectious disease and requires acceleration of efforts to end it in Nigeria and even globally by the year 2030. Kemi Balogun, TVC News, Abuja.